Hello, we're here at Biotech Place and Innovation Corner in downtown Winston-Salem. My name is Dr. Heath Thornton. I'm a sports medicine physician and the medical director for the athletic training program here in Winston-Salem, Forsyth County. That's in collaboration with Wake Forest Baptist Health. I'm here to talk today about concussions, and I have with me Chris Ina and Dr. Jill Urban. I'm going to let Chris introduce himself.
I'm Chris Ina. I'm the athletic training coordinator for Wake Forest Baptist Health. I manage the 12 high school athletic trainers in the county. I'm an athletic trainer by trade, and I'm going to talk to you about on-field management of concussions.
And I am Jill Urban. I'm an assistant professor of biomedical engineering here at Wake Forest Baptist Medical Center. And I'm here to talk to you about our research in head impacts in youth sports, as well as concussions in youth sports.
So like I said, my name is Chris Ina. I'm an athletic training coordinator, and I'm going to talk to you a little bit about concussions and the importance of, recognizing when your child has one and some of the signs and symptoms. But the big thing, concussions is a big buzzword today in the media. You hear it all the time if you watch any sporting event or even on newscasts on the weekends. So why is it important really to manage these concussions? Well, number one is if concussion goes unmanaged, it can really cause some significant damage to the brain. So recognizing those signs and symptoms, and the earlier you can seek care, the less risk there is to that brain damage. And with a great partnership with the Winston-Salem Forsyth County Schools, the hospital has employed 12 athletic trainers. We have one at every high school in the county. So they're protecting your children when they're playing sports, whether it's football, whether it's cheerleading, golf, tennis. They're there every day at the school providing care to your athletes. And their main role is, as an athletic trainer, they're really the first line of defense when it comes to injuries and especially concussions. They're all trained in recognizing signs and symptoms of concussion. They're all trained in management of the concussion. So, when they do recognize that an athlete does have a concussion, they can pull them off the field, and that's really the first step, is remove them from play so they're not at risk of getting any more damage to their brain. And keep in mind, too, that the concussions aren't really just in football. Yesterday in our concussion clinic at our sports medicine Stratford location, we saw a volleyball player that had a concussion. She had fallen on the court and banged her head on the floor. So it's not just football, it's basketball, it's soccer, it's lacrosse, cheerleading. They actually instituted a new rule in soccer that if you're under the age of 11, you can no longer head the ball. So they're really trying to protect those kids, those younger kids, from having that extra head trauma. So some of the signs and symptoms, Wake Forest Baptist Health, but they really need to be seen by a medical provider, even their PCP, just to kind of, get that ball rolling, making sure that they're getting that proper care. And then I can give it to Dr. Thornton, he can kind of tell you about what the physician side of the care is.
I agree, Chris, and I think the big thing that take away from those early moments when there is a concussion, or at least concern for concussion, is that early recognition. Once you're able to identify that there is a suspicion or a concern for concussion, then it's a matter of getting in for that evaluation. Whether it's the athletic trainer at the school, or the team physician at the school, or going in, as Chris said, the primary care doctor or a concussion specialist. We believe that it's best to have these athletes, these individuals who've had a concussion, to be seen within 2 to 3 days from the injury. That allows us to really be able to initiate the best evaluation to make sure that it is a concussion and that there's nothing else more serious going on. It also allows us to get the right treatment so that they can recover the quickest. Now, here at Wake Forest Baptist, we have the privilege of being able to take care of quite a few teams, professional with the Winston-Salem Dash, college level, such as at Wake Forest University, and also the high school level, Winston-Salem, Forsyth County Schools, and even some of the younger community leagues. And what we've seen, as most people know, is that these concussions happen at, just as Chris said, at any age, and they happen at any sport. And so we have to keep an eye out for these sort of things. The other thing that we've noticed, having seen so many concussions, is that every concussion is different. There's not one way of diagnosing concussion. There's not one set of symptoms. So it can be quite subtle at times, or it can be quite obvious. For that reason, it's important to get into a clinic setting where we can do an evaluation. There's a number of different specialized tests, examinations that we do in order to really determine whether someone has a concussion and then what's the best next step to help them get better. And it can be different for different ages or different types of injuries. And so that's the reason why we like to see them early on in the clinic to start that treatment. Treatment-wise, as I said, it can vary a fair amount, but one of the first things we like to do is allow the brain to heal, so give it a chance to rest. And there's a certain time period that'd be great to eliminate all kind of stimulus to the brain, but then we also don't want to disrupt their normal life, such as our athletes in high school. They're used to going to school, they're used to seeing their friends, communicating on Facebook or these days, I guess more Instagram for that age. They're used to these things, and when you disrupt that significantly, then there's a lot of anxiety associated with it. So while we want to rest initially, at some point we have to decide, when do we start getting back to the normal routine? How do we get them back to school so that their symptoms don't worsen with all the stress that comes at school, both academically and socially? And so those are the things we look for. Now, most concussions, thank goodness, are better within a week to sometimes 3 weeks. And those are great, because then we're able to get them back to normal activities, get back to playing their normal sports. But there are some cases where these symptoms can be prolonged. Those get very complicated. There's subtle things we look for, such as specific symptoms that we might try treating with medications or therapy, and sometimes even counseling that can be helpful for these athletes with the long symptoms. And we have other techniques we can use that help them keep up with their schoolwork, which is always a concern, especially if they're having difficulty actually being in class because of the stress that comes with that. And those are the sort of resources we can help these athletes get tapped into so that they can do their best to be able to keep up with their schoolwork. Now, one thing everyone needs to understand is, as much as we know about concussions, as much as we've learned over the years and we try to take care of, there's still a lot of questions out there. I have many times parents asking me, what's going to happen down the road? What is going to happen if my kids have 1 or 2 concussions? Are they going to have permanent damage in the brain? What is the risk for future concussions? And while we have good ideas, we have some evidence to support that, there's still a lot of questions out there. And for that reason, there's a lot of research ongoing currently, which we're doing here and other places are doing also. And so in order to help explain a little bit more of some of the research we're doing, I'm going to turn the time over to Dr. Irvin.
Thank you. Well, myself and my fellow collaborators here at Wake Forest Baptist Health have been working for the past 5 years to better understand impacts in contact sports such as football and more recently soccer. Through the support of the Children's Institute for Pediatric Trauma and the National Institutes of Health, we've collected head impact, neurocognitive, and imaging data from over 200 high school and youth football players. We've collected tens of thousands of head impacts and medical images on a scale that's really never been done before. For several years, researchers have been studying professional and collegiate football players, and there are currently 2,000 NFL football players and about 100,000 collegiate football players. That's 1 NFL player for every 50 collegiate football players. However, these statistics are really just the tip of the iceberg. There's approximately 1.3 million high school football players and 3.5 million youth football players. That's just under 2,000 youth football players for every NFL football player. We have a tremendous number of youth athletes, and it's the age group about which we know the least. Our young athletes are going through development, and their brains are developing at a critical time point when they're playing youth sports. And so one of the questions that we want to ask is, what happens to the brain if a young athlete has 100, 500, or even 1,000 impacts to their brain over the course of a football season? And what can we do to avoid or mitigate these impacts? Now, we commonly think of exposure when we think about sun exposure. We can apply the same concept to head impacts, where the concussion is a single bad event, similar to a sunburn. A season or a lifetime of exposure is analogous to a lifetime or a summer in the sun. While concussions are important, we're also interested in the effects of exposure to repetitive head impacts that might occur over the course of a single season. There are 2,000 youth football players for every NFL football player. We have a tremendous number of youth athletes, and it's the age group about which we know the least. Our young athletes are going through development, and their brains are developing at a critical time point when they're playing youth sports. And so one of the questions that we want to ask is, what happens to the brain if a young athlete has 100, 500, or even 1,000 impacts to their brain over the course of a football season? And what can we do to avoid or mitigate these impacts? Now, we commonly think of exposure when we think about sun exposure. We can apply the same concept to head impacts, where the concussion is a single bad event, similar to a sunburn. A season or a lifetime of exposure is analogous to a lifetime or a summer in the sun. While concussions are important, we're also interested in the effects of exposure to repetitive head impacts that might occur over the course of a single season. We're studying this using several methods: before the season, after a concussion if they get a concussion, and after the season. We collect medical imaging and neurocognitive data from our athletes. The athletes that are participating in the study come to the hospital for their appointment, where we perform a computer-based test that tells us how fast they think or how well they remember things. And we also collect medical imaging data, including a magnetoencephalography scan, or MEG, which listens to the brain, specifically the magnetic activity of the brain, and an MRI, which takes different pictures of the brain, but with no radiation. This together allows us to measure the functional activity of the brain as well as the structure of the brain. Now, much of our work is focused on the imaging and also includes the biomechanics data. So in between their pre and post-season scan, they play football. And so to measure their head impacts, we instrument their helmets with a sensor. It fits right within the existing padding of the helmet, and there's 6 sensor systems that sit right on the crown of their head. The data is wirelessly transmitted to a sideline laptop computer that tells us where they're hit on their head and how hard. We measure acceleration, and that's a measure of the severity of the hit. And these data really help us better understand their head impact exposure on the field in order to better inform safety on the field, helmet safety, as well as better understand age-specific injury risk and injury mechanisms. Our imaging collaborators here at Wake Forest and at UT Southwestern measure changes in the brain from the MRI and the MEG scans, and they're looking to see if these changes correlate to the number and severity of head impacts that we measure on field. Much of the research that we've been doing for the past several years has been focused on the hits that do not cause a concussion, those that are part of regular play. And we found that the higher percentage of impacts that we measure for a single athlete actually occur during practices compared to games. And within practices, we see that there's quite a bit of variability in the head impact exposure that we measure depending on the drills that they are participating in on field. So, for example, open field tackling, which is a one-on-one drill where the athletes are tackling each other at greater than 3 yards apart, results in the hardest hits, whereas multiplayer tackle, which is a multiplayer blocking drill, results in the highest numbers of hits. This information can help us inform evidence-based recommendations to reduce head impact exposure and concussion risk. Now, there's many opportunities that go beyond football, and we've been recently expanding our efforts to youth soccer. And for the past 2 years, we've been working through the support of the Children's Institute for Pediatric Trauma to develop an instrumented mouthpiece that can be used in both non-helmeted and helmeted sports. I've got an example here. For our athletes, we collect a custom dental impression, and we make a mouthpiece that contains the sensor system that measures similar to what we're measuring in the helmets. It tells us how their head is moving during each and every hit. And the mouthpiece is made unique for each athlete. And it tells us both the number and the severity of the hit. And we've piloted the device in a competitive girls soccer team and evaluated differences in ball delivery methods. So for example, we've looked at if the ball was kicked to an athlete while they headed the ball, thrown to them, or headed from another athlete, how that might change the severity of the hit. We're currently moving forward to study another competitive girls soccer team this fall and look forward to learning more about head impact exposure that might occur in other sports. Now with the biomechanics data that we collect, we hope to continue to expand upon our work and learn more about the factors that influence head impact exposure in sports so that we can better understand how to reduce head impact exposure, concussion risk, and ultimately improve safety in sports.
Thanks, Dr. Irvin. So that you can see there's a lot of research going on, a lot of questions trying to be answered. And certainly I'm sure you guys have questions that you would like to ask, so we want to start opening it up to questions you may have to submit to us. One question that we had is about individuals who played sports in the past, like when they were younger, now they're in their 20s. And a question that gets asked frequently is, hey, what about my brain? Has my brain been damaged because of concussions I had in the past? And while we're using a lot of imaging currently to look for special types of imaging, to look for changes in the brain in recent concussions, there's really no evidence to show that the other imaging you may get, like CT scans or MRIs at the hospital, are going to find any changes. In fact, concussions shouldn't have any real changes in the brain on those types of imaging, which are very different from the research imaging that's available. So I typically tell folks that there's no need to do any sort of imaging unless there's some sort of change in their function, in that they're getting worse, or we have some other concern about a more serious injury.
I think one thing to point out too is, if you think about a concussion, it's not, you don't have to be knocked out cold. You don't have to be unconscious to have a concussion. And that's what's interesting about Dr. Urban's research, is what we're finding is, like, the bigger the impact doesn't equal a concussion. Sometimes it's the really small impacts. Everyone's brain is different. So you just can't watch an event or watch a play and watch two players really collide and have a big collision and just assume someone had a concussion. And then what she's found too is with some of those individual little blocking drills where they're just kind of bumping heads multiple times during practice, that is almost more concussive than those big hits. So her research is really helping to really define those, I guess, those rates or those roles, kind of how your brain responds to those forces.
And of course, every head hit or every head injury is not necessarily a concussion. Sometimes people get hit in the head and they might have a little knot on their head and it's sore there, but they don't have any change in the function of their brain. And so we certainly don't know right now what are the long-term consequences of, as Chris was saying, these kind of not concussion hits. But one of the important things is just making sure that we don't ignore head injuries, that we get evaluated, try to get the athletes evaluated so we can make sure that there are no concussions and no other serious issues. So we're going to wrap up now, and so we want to make sure that you're aware that if you have any questions that you would like answered, if you want more information about our concussion care or our concussion research, you can certainly call, communicate through Facebook, or you can call Wake Forest Baptist at 716-WAKE, W-A-K-E, or visit one of our sports medicine locations either at Miller Street Medical Plaza or at Sports Medicine Stratford.